Right. Good evening, friends. I'm Dr. Shefali Dinesh Jain from Asian Institute of Infertility Management, Indore. I am very pleased and delighted to address you in this live session on this platform. I'm Fine is a great initiative towards building a community of like-minded females and addressing their common issues. I appreciate you all coming forward and rather feel privileged to be a part of this forum and hope to help you in the best possible way. We have been receiving many questions on different platforms. Interestingly, few of my patients called up saying that, doctor, please talk on few aspects of AMH, maybe age, because my mother-in-law doesn't let me come out of the house for subfertility treatment, and maybe some blastocyst transfers, and lot many other issues. I request you all to post all your questions for myths and confusions in the field of infertility. Please note that this is a general awareness discussion, and for specific issues and problems, you have to consult your gynecologist. I'm looking forward to a great and fruitful communication to sort out all your fertility issues. Now let's come straight to the topic. The topic is myths in fertility treatment. There are many myths and misconceptions that surround the human lives, especially when the problem is like infertility, and they feel that it is so difficult to discuss with any of your family members and friends because infertility issue is still not openly discussed in our culture. This is considered to be some kind of deficit or maybe lack of completeness from women's point of view, and therefore many of them do not go to the doctor and take proper advices. I think it is not an individual problem, but rather the entire family, the friends, the neighbors, the office staff, all are involved, and when it is so, the couple has generously been receiving lots of advices right from bedroom recipes to avoiding specific food in the diet to to stop bending and picking up the weight after having sexual intercourse when they're trying in the fertility window, and maybe avoiding exercise, which is rather detrimental for the case. Initially, the grandma's counseling and stories are being narrated to the couple when she gives a lot of examples to their daughter-in-laws and of success of their neighbors or friends. Falana ki bahu, uski beti, she had the same problem, and it got sorted out with very simple jadi booty or something, something like that. A lot of people are forced to go to alternative medicines. So these are the actual issues. All advices are not based on any scientific evidences, and this creates more confusions in the minds of couples, which prevents them to reach to fertility expert, and sometimes when they follow the expert, probably they are too late. Now, if I talk of the myth, I remember that when I started my practice, maybe 27 years back, that time mother-in-laws used to get their daughter-in-laws saying that, you just treat her or you just investigate her because my son is hale and hearty. He cannot have any problem. Even if the son would come accompany the women, then probably he would not want to give his semen sample for analysis. But thank God to these social platforms and awareness which is created. And now I think the husbands are usually accompanying their wives, and they are not resistant to test anymore. Why we advise semen analysis on the first occasion? We advise semen analysis because it's the simplest test which can be performed to rule out a male factor. It is not because we are suspecting anything wrong in the husband, but rather it rules out, so we have to treat the female. And I think now we just analyze the semen analysis is being done, and further opinion is given to the couple. Another issue, another myth. Many a times the couple has been investigated partly or completely, and whatever they have done, all the reports are normal. So either they are advised to wait and wait and wait and not take any proper treatment. Is this the solution? I would say no. And maybe this is not even the case, because we are talking about unexplained infertility. But first of all, whenever this is so, we have to evaluate whether all the tests have been completed. A basic investigation is required, which involves husband's semen analysis. We need to check whether wife is ovulating or not. We also need to check whether the tubes are patent and the uterus is normal. So all these things have to be done. But more than performing these tests, it is very important whether these tests have been done correctly, and also they have been interpreted well, because there may be problem with either of them. But this case can be purely unexplained. That means the husband's semen analysis is normal, wife is ovulating, tubes are patent, and the uterus is also good. In such cases, there is a problem, but probably this problem has not been known, or probably the problem is so much internal or intrinsic that it cannot be diagnosed by these routine tests. Now, what could be these problems? These problems could be either the egg quality is not that good, maybe the semen analysis is normal, but what we are assessing in semen analysis is only the semen count, the motility, the morphology, and ruling out infection. But we are not looking into the functionality of the sperm. What does the functionality mean? It means the fertilizing ability of the sperm, whether it has an ability to fuse with the egg. That cannot be judged by a simple semen analysis or any other report. When we talk of the tubes, maybe the tube is patent, but whether it is functioning or not, the function of the tube is very specific. It has to pick up the egg. It has to bring the sperms inside, and probably that is the place where fertilization takes place. Fertilization is the process in which the egg and the sperm fuse together. So all of us present here who are born have actually started our lives in our mother's fallopian tubes. So tubes are very important, and they have to be patent as well as functioning. Apart from this, we have talked about egg, we have talked about sperm, we have talked about the tube, but we have to talk about uterus, which is going to have the baby for next 9 months. And there may be some problem with the holding capacity of the uterus. So all these things may exist in a case of unexplained subfertility. And believe me, that such couples do not have to sit at home. This is a myth. They may conceive naturally. We don't say that they will not conceive, but the timely conception is again very important. And in such cases, there is a protocol of treatment. Maybe we just give them few medicines. Maybe we just give them simple treatments of IUI. And suppose nothing works, then probably they are candidates for advanced treatments like IVF or ICSI. So the myth is solved that they don't have to sit home, or rather they have to take some kind of treatment. Now, the next thing. Probably the myth is that a girl is waiting to get pregnant, and again in her case, she's just said that maybe everything is normal, and she just waits for every month that maybe she would miss her period this month, but it doesn't happen so. And the mother-in-law or father-in-law or maybe the family members say that Bhagwan ko jab dena hoga de dega. Yes, of course, we all believe in God. We all believe that there's some supernatural power which helps everyone. But the biological clock is ticking. We have to make some efforts to it, how things can be done. And as you advance in age, the quality and as well as the quantity of egg deteriorates. Any girl child is born with a finite number of eggs and maybe 1 or 2 million. And every month, few eggs start their journey and they are destroyed. Mostly the eggs are destroyed, and out of them, one of them reaches the dominance, and the dominant follicle is released. And maybe if she doesn't get pregnant, then all the eggs get destroyed in that particular cycle. This means you're just exhausting your eggs and rather not forming any new ones. So at one point of time, the ovary exhausts its reserve, and that is a time which is very crucial. So timely intervention is very important. So if you are one of those, just maybe you would conceive on your own or with with very simple medicine, but at least you have to meet a fertility expert. A lot of times I'm asked, what is the ideal time for conception? If I tell you this, then most of us will be surprised to know the age which is the peak fertility age. And that is, when I read about it, it was 18 to 23 years. If we talk to our children that this is the best time, then probably they will laugh at us. It is not possible because now children are career oriented. They want to do something, they want to achieve, they have their own dreams and vision in life. But maybe if you are one of those who wants to delay childbearing, maybe till late 30s or maybe till in 40s, then please, the advice is that you should consult a fertility expert before it becomes too late, because there are options of fertility preservation, there are other options, so that maybe even if you want to delay your childbearing, then still you can delay it, but then finally it should be all in a planned way. When I'm asked this question, I tell my patients, or I tell few of my friends ask, my kids are not wanting to get pregnant, what should I do? So we just tell them that they have a right to conceive when they are mentally, financially, physically, emotionally ready for conception. But please consult your fertility expert or gynec so that proper advices are executed. And in case they need fertility preservation, that can be done. I see a lot of names here and a lot of people greeting me. And I think I'm really very happy and very delighted to be here. And I say hi to Neha, Vipin Kumarji, Birjuji, Rajji, and Mr. Raj has even asked me, hello ma'am, I'm 30 years old. I had one attempt of IVF but was unsuccessful. And my embryos are frozen. I want to ask that if one attempt has failed, then we will be using the same embryos that are kept in cryopreservation, and my chances will be less, or should I go for frozen embryo transfer or not? Oh my God, Raji, this is a very relevant question, because this we are asked every now and then. And we just tell them that, it is very unfortunate that you could not conceive in your fresh as well as frozen embryos. But if your embryos have been frozen, so that means they must be of very good quality, because and nowadays the result with frozen embryos are also good. But just talk to your doctor. If your embryo quality was good, then probably it was just by fluke that you could not conceive in these attempts. But you should take another attempt, because every time the implantation is not same, and you have very good chances of conception with frozen embryo transfer in subsequent cycles whenever you have such a case. So my advice to all these audiences who are listening to this is that please go ahead with your embryo transfer, because Even with frozen embryo transfer, the chances are very good. Rather, they are better than fresh ones sometimes in a particular subset of women. And this should be taken attempt. This should be attempted, and you should not think about it unless your doctor thinks that these embryos are not good. And maybe if you have frozen your embryos in day 3, you could take them to day 5, the blastocyst stage, and then transfer, so that the chances of pregnancy and implantation are further enhanced. So you need to talk to your doctor regarding this, because we are not aware what was the lining of uterus, how your uterus behaves, and what factor was it. It's just by this question, I would say that please go ahead with a frozen embryo transfer. I have another question from Upasna. Ma'am, uterus ki tube block or uterus chipka jale bana hai. Okay, so I interpreted that आपकी uterus में जाला बना है, that we call it as Asherman syndrome, and tubes भी बंद हैं. ट्यूब्स को देख नहीं सकते हैं उपासना जी, बिकॉज अगर यूट्रस में चिपका हुआ है तो उसमें से हम कुछ भी टेस्ट करेंगे तो वो डाई जो हम देखते हैं टेस्ट करके वो मालूम नहीं पड़ेगा. पर इसका मतलब ये है कि आपके केस में कुछ ना कुछ प्रॉब्लम जरूर रहा होगा. यूट्रस का चिपकना यानी एशरमैन सिंड्रोम जो होता है वो किसी इन्फेक्शन की वजह से हो सकता है, या फिर हो सकता है कि आपको ट्यूबरकुलोसिस की प्रॉब्लम रहा हो, या आपको और कोई डीएनसी वगैरह हुआ हो आपका, जिस कारण से आपकी दोनों परतें यूट्रस की चिपक गई हो, और उसका जो ट्रीटमेंट है वो काफी अच्छे तरह से हो सकता है. उस केस में हमको हिस्ट्रोस्कोपी करना पड़ता है. हिस्ट्रोस्कोप मतलब एक बहुत छोटा सा टेलीस्कोप होता है जो आपके बच्चेदानी के मुंह से डालते हैं, और उससे आपके जो दोनों परतें चिपकी हुई रहती है उनको सुलझा दिया जाता है और दोनों परतों को अलग कर दिया जाता है. और साथ ही साथ जब हम उसमें से दवा डालते हैं तो ट्यूब भी खुलने का चांस रह सकता है, और अगर ट्यूब बंद भी हो, आपका यूट्रस की दोनों परतें सुलझ गई हो, तो आपको टेस्ट ट्यूब बेबी के द्वारा प्रेगनेंसी हो सकता है. तो आप जहां भी हैं अपने फर्टिलिटी एक्सपर्ट से कंसल्ट करिए, जिसमें कि आपको वो सही सलाह दे पाएंगे. और आपका हिस्ट्रोस्कोपी करके आजकल एक और ट्रीटमेंट आता है जिसको PRP या स्टेम सेल कहा जाता है. ये कुछ ट्रीटमेंट्स होते हैं जिसमें कि यूट्रस की परतें सुलझाने के बाद उनमें वो दवा डाली जाती है जिससे आपके चांसेस बढ़ जाते हैं. सो I have few more people. Greetings, Saurabh, Anand. Good afternoon, good evening. Kiran ji, such an inspiration. Thank you so much. You're liking it, Kiran. I'm very happy. Jagrati, Ragini. Okay, so Ragini has a question. My niece, 28 years, has PCO and has gone one fresh and one frozen attempt with IVF, which have been unsuccessful. What can be done to improve her further chance of conception? So I think Ragini, your niece had PCO and she was maybe she never responded. You have not said that how many years of marital life, but probably it must have been more. And she has undergone one fresh and one frozen cycle, and that has been unsuccessful. But I would want to know further details why this was unsuccessful. Firstly, because maybe your niece is overweight, maybe she's not metabolically stable, maybe her endometrial lining was not too good. But in cases of PCO and in young PCO, suppose she's just 28 years old, then I see very good chances or prospects. You just need to improve the metabolic milieu or the profile. We have not even specified what was her age, what was her weight and other things. I believe if she goes for a diet, this thing, and maybe lifestyle modification, probably she has very good chances. And in PCO cases, we just follow a protocol of freeze-all. That means we stimulate the ovaries because there's a greatest risk of ovarian hyperstimulation. And probably, I don't know whether she had any problem or not, but we just try to give her a little higher dose of gonadotropins, make the oocyte ready, and take out all the pick up all the eggs and make the embryos, and then keep them in for cryopreservation. And maybe after 2 months, when things settle down, maybe her hormones are more in balance, maybe the uterus is more acceptable for accepting the embryos, and that is the time we transfer the embryos. Because in cases of PCO, there is mostly a mismatch, that is a discrepancy between the endometrial lining and the embryo, and that may be the reason for failure. So I hope this satisfies you, Ragini. And Rajesh ji, I greet you, and Gauri ji, and Pushpalata ji, and Guria, Leena, hello to all. And Neha Gupta ji, what may cause infertility in female and male? I think I'm coming to this because there may be a lot of factors which may be responsible for male infertility and female infertility. And if we talk of female, then probably it could be the oocytes, it could be the tubes, it could be the uterus, which may be responsible. It could be some hormonal imbalance, which may be responsible. And these are tested by few simple tests. So we need to check whether the woman is ovulating, whether her cycles are regular, whether her tubes are patent, whether your uterus is good. So it could be one of these factors. And mostly, I mean, we see tubal factors, polycystic ovaries, endometriosis in our country. If we talk of male infertility, there may be various reasons for male infertility. And we just do a semen analysis in such such patients or such men. Maybe we find a normal semen report, as we have already discussed a few minutes back, that maybe a normal semen report may also have some problem in male. Maybe the count is low, maybe the motility is less, or maybe the abnormal forms are more, that is, a sample may have poor morphology. And the factors which may be responsible for all these things can be various, starting from infection to varicocele, which is very common, or maybe there's some hormonal disturbance in male, which can be treated very well. Now, there's another group of men who may have azoospermia. Azoospermia is absence of sperms in the semen, and there may be various factors. It could be obstructive, it could be non-obstructive. So there are many reasons for it. It could be related to genetics, it could be related to Y chromosome, it could be some other factors, it could be some obstruction with common vas difference. So there are various factors, and for this you need to consult a gynec for finding out various reasons to it. Now I think we can just go ahead with other things, and other things which we need to discuss, as have been asked by various other people, is AMH levels. There are a lot of myths regarding AMH levels, and people generally ask, I have very low AMH levels. Can I never conceive naturally? This is a common question which is posed to us, and every day in and out we have to answer this question. So there are a lot of questions and myths regarding AMH, right from asking to, can I improve my AMH level? Why two reports are different? Report done in January is 1.4 and report done in June is 1.6. So maybe I have improved, or what exactly it is. And then I'm asked whether miscarriages are caused by low AMH level. So AMH, you have to understand, it is nothing but a hormone which is formed by granulosa cells or small preantral antral follicles, and it signifies your ovarian reserve. That is the number of eggs which remain in the ovaries and which are available for further conception. AMH does not tell you that you can never conceive a baby, or even if your AMH is low, probably you have good chances. But then we cannot comment on this by just one report. It just means that you have limited time and you should hurry up with treatment. In this case, we recommend that you should seek help from a fertility expert as soon as possible, who can check your AMH and they again do another test, that is antral follicle count, which is done by transvaginal sonography after your menses. And if your AMH and AFC levels both are low, probably they would just ask you to take the proper treatment as soon as possible. So it doesn't say that you may not conceive. You may conceive naturally, maybe with IUI, but IVF. But before the AMH becomes further low and your ovaries are exhausted of eggs, you should conceive. So just by one level, we cannot comment. But if all the other ovarian reserve markers are also low, probably you need a more aggressive approach, and more aggressive approach may be IVF or ICSI. Now, regarding increasing your AMH level, there is no way to increase your AMH level, just as you cannot reverse your age. Suppose a person is 35, she cannot go back to 30s or 25. Similarly, if your AMH is low, you cannot rectify the problem, and it cannot be definitely not be done by any medicine. But there are medicines, there are treatments, medicines in the form of DHEA, androgel, which are available, which increase the availability of egg only temporarily, that is transiently. Sometimes with very low AMH, we also give intra-ovarian PRP or stem cell, and these are less established but very effective treatments. And definitely before opting for anything like going for donor egg donation, donor eggs, probably one can opt for these things and try if something works out. So this is regarding AMH. Now we have few more questions, I believe. Praveen is asking, hello ma'am, my friend 41 years old never attempted for conception due to some personal reason. Should her freeze her eggs or freeze embryos? Kindly advise. Firstly, Praveen, I think your friend is rather little late, and she's already late. Now, 41 years of age, we really don't know how many eggs are remaining. So the chances with egg freezing or embryo freezing, I think they are just an illusion probably. She should just consult a fertility expert and find out what is best for her. We have to check what is the number of egg remaining at present, and then we can finally tell her that, because at 41 years, I think she must have exhausted all her eggs. And even if she has few eggs, or maybe she was a case of PCO, probably she should just immediately go to a fertility expert and go for a particular treatment. Next question is from Rajan Ji. Women who have suffered from PCOS and having AMH 23.1 nanogram per ml prefer treatment. You know, Rajan Ji, these are the most difficult subset of patients out of all PCOS, because a very high AMH level, it is very, very difficult to, stimulate such ovaries. And in such cases, we generally have to go in for more advanced treatment. In such cases, we ask the women to go for ovarian stimulation, and whatever the result is, we bring out all the oocyte from her body. That is, we do an egg pickup, and if in case she is married, we can take her husband's semen sample and just do IVF or ICSI for her. And these embryos which are formed are cryopreserved, and then whenever she wants pregnancy, we can transfer, whether it is immediately after 2 months of frozen embryo transfer, and suppose she's not married or whatever, then we can think about it later. But she definitely needs a proper ovarian stimulation and see the response, how it is. Jyoti Ratri Mundra, multiple uterine fibroids, 2 times miscarriages. This sounds very interesting. Jyoti ji, you have multiple fibroids, so maybe the uterus is, we actually don't know where these fibroids are, but probably they must be distorting the cavity, and since they are multiple or they are more in number, and in such cases, whatever it is, we should go in for myomectomy and then attempt pregnancy, because this could be one of the reason, because the endometrium or the implantation is disrupted, and the embryo and the endometrial interface, that is the lining between the endometrium and the embryo, has some problem, and which may be responsible for the miscarriage. So definitely the next pregnancy should be attempted in a more anatomically normal uterus. So this is what I would suggest. So now we can, Neha Gupta ji is asking, ma'am, I have problem when I am in period time, my whole body are swelled. What is the reason? Yeah, so Neha ji, this, I mean, if your body is swollen just before your periods, then probably it could be because of some hormonal imbalance. There is a hormone called progesterone, because of which there is a lot of water retention. So women or the girls feel bloated up before periods, and as soon as you begin menstruation, then probably you feel lighter and better. But in such cases, you have to take treatment, maybe some pills or something, which can take care of the problem. And if this swelling exists throughout the cycle, then probably you have to investigate further for any kind of hormonal imbalance or any other problem which could be related to edema, swelling. Savita Bansal, ma'am, age 23, AMH is 1.8, FSH 0.95. What treatment should I get for pregnancy or conceive? I think AMH is okay, but your FSH is on a lower side. We have to check, Savita, because you are young, and we want to know about the pattern of your bleeding. But with low AMH, we can stimulate with whatever AMH it is, and with your low FSH, we have to do LH levels also. Maybe you have some hypogonadotropic hypogonadism, that is some kind of hormonal imbalance, and in such women there are good chances of pregnancy by stimulating the ovaries with gonadotropin injections which are available. So we have to give you hormonal injections, and maybe things get better. So now we come back to our own discussion till we get more questions. So I request you all to put lots and lots of questions so that all your queries are sorted out. And I would love to give to answer many other queries that you have in your minds. And we all know that we've been sitting home since past 1.5 years, and a lot of our patients are not able to come. So this is a good platform in which we can interact, we can talk, we can solve your doubts. So please post questions, all of you. Now there are a few other myths which are there. These are small little myths, and I get a lot of patients whose periods are not too regular. They scantily bleed, or maybe every 2 or 3 months, and they come with their mothers or mother-in-laws and say that, doctor, please regularize the periods first, and then probably we'll think about pregnancy, or pregnancy to ho hi jayega once the periods are normal. But this again is a myth, because we have to find out the underlying cause why her periods are irregular and why she bleeds every 3 to 4 months. Because the problem could be somewhere underlying. It could be a hormonal problem. It could be related to obesity. Maybe she's overweight or obese. Maybe PCO. Maybe hypothyroid. Maybe hyperprolactinemia. And you need to go in for some hormonal investigations. And once the cause is known, then treatment becomes quite easy, because if it is thyroid, probably we can go for some medication. If it is prolactin, we can treat that. And if it is polycystic ovary, then definitely a proper treatment plan is initiated. She needs some kind of lifestyle modification and advices. And most of the times, if we are dealing with infertility, or she is unable to conceive, then probably we have to treat in such cases only, like her periods are irregular, and we have to execute treatment like this without correcting the menstrual cycle, because this menstrual cycle is just corrected till the time the medicines are taken. As soon as you stop the medicine, the same thing, again happens. So this is not correct. Rather, we have to just give you medication, and we have to find out the reason. So this is again a myth, that correct menstrual cycle and then finally we will go for any infertility treatment. That is again a myth. Now there are certain girls who are young and who don't even get their periods, and the parents think, or the in-laws think, that she will never be able to conceive. So they have lost all hopes, and put this in her mind also, that see, you have to remain like this and you will never conceive. So again, this is a myth. There are some correctable causes, I said, like polycystic ovary, which may in which the girl may have only withdrawal bleeds, or some thyroid dysfunction or prolactin. Apart from this, it could be related to genetics, like there may be causes of premature ovarian failure, in which the girl may require donor eggs, or it could be some uterine factor. The uterus is either so small, hypoplastic, or maybe we can improve by medicine, or if the uterus is congenitally absent, it is not at all there, then probably she can conceive with surrogacy. So this is again a myth, that this girl can never conceive. Now I think, do we have more questions in the box? Let's see. Manoj Srivastava is asking, my friend and her wives, all laboratory tests and parameters are normal, still unable to conceive. So can you suggest how do we go ahead? So Manojji, we just talked about this aspect little while ago. But again, I'll repeat that this is a case of unexplained infertility, as all the investigations are said to be normal. But I don't know about your friend's wife age. If she is young and other things are normal, probably they can go for simpler treatments of IUI for 2 or 3 months. And suppose she doesn't conceive, then you can go for IVF or advanced treatments. But suppose her age is maybe more than 34 years, 35 years, and maybe her marital life is more than 5 to 6 years, probably it is better that she takes a definitive treatment and she sees a fertility expert and they go for IVF ICSI. Chitranjan ji is asking, 3 times IUD, 6 months twins, 3 months, 3 months pregnancy, and last year 7 months pregnancy, lost baby due to PIH. All tests done, took Lonoprin 40 for first 3 months, and then weekly as prescribed by doctor. My AMH is 3.4. I should go for IUI. See, Chitranjan ji, you have got a very valid point, that whether you should go for treatments of IVF or IUI. But I would recommend that, since your wife has conceived naturally 3 times, so I think more importantly than doing IUI or IVF, she conceives naturally. So your wife doesn't need any treatment like this, but rather we have to find out, or we have to prevent her PIH, or we have to just execute certain treatments which would prevent rise of blood pressure, as well as keep the baby safe for 9 months. There are certain treatments like low-dose aspirin, heparin injections, which are blood thinners, and many other treatments which are there. So you have to see the best obstetrician or gynecologist and get your case treated. In case she doesn't conceive naturally further ahead, then probably you require IVF or IUI. IUI or IVF is required for those women who do not conceive naturally or by other means. So I think this answers your queries. Suman Bansal, ma'am, मेरा IVF 2 बार फेल हो गया है. पहली बार ट्विंस थे, तीसरी मैं मिस हो गया, सेकेंड टाइम बीटा टेस्ट नेगेटिव आया. अब क्या हो सकता है मैम, प्लीज बताएं. So Suman, I think you have conceived in the first occasion. You have conceived in the second occasion as well, and third was negative. But Second time was negative, and okay, so now you want to know what. So suppose you have to I mean, I have to know about your age, your marital life, as well as your AMH. Why this second attempt I mean, was unsuccessful? Suppose there's a reason that your doctor could tell us that why this was unsuccessful. I could be in a better position to tell you that what exactly you need to do. So this is what I would say. Now we again go back to our queries session. I'm in the midst, and some people I get, and previously I was getting more people like this who would say that the cause of subfertility is mera uterus chota hai, mera uterus tircha hai, the retroverted uterus, or the mouth of uterus is very small. So they still come with such queries that this can be the cause of subfertility. That is again a myth, because all non-pregnant uteri are small in size, and the uterus is the only organ in the body which has the capacity to distend. It is a muscular organ. It can accept babies, or it can keep the babies of 3 kilos, 4 kilos, maybe twins, triplets are born. So no, uterus is very small. It is a myth again. And some infertile couple very sweetly would say that whenever we have intercourse, the semen comes out. This is a question which is posed by most of our patients. So we just tell them that the sperms have the ability to travel inside the uterus and reach the fallopian tubes. So don't worry. The semen has lot many other components which provide nutrition and pH, and those are the components which come out. The motile sperms, they are sent in 30 minutes or 45 minutes inside the uterus and the fallopian tubes. So I think these are the common queries. Few people have obesity and still they think that this can never be a reason for their not conceiving. And probably, it is, I would say that since obesity is there, maybe irregular cycles, and this affects the ovulation. It also affects the egg quality, the fertilization and implantation. So anybody who is going for a infertility treatment should reduce the weight, should have a healthy lifestyle, and that is what is very important to follow. So I have Savita Bansalji, ma'am. Without medicine, my period's not coming. What should I do what should I do and how to conceive? I have low LH and FSH. Again, I have taken up this question a few minutes back also. So Savita ji, you have very good probability of conception because your FSH and LH are low. So you just need to see a fertility expert. And this is a case of hypogonadotropic hypogonadism, in which your glands are synthesizing less hormones. So whenever we supplement these hormones from outside, then you have very good chances of conception. So I think you need to go for treatment, and the results are good. Any more questions? Ma'am, please advise. My IVF is painful. My sister is considering it as an option. Payal is asking. So I think Payal, IVF is not painful. This is one thing which I can definitely say, because IVF just involves things which are suppose the women comes or the girl comes. It just involves a sonography. It just involves egg pickup, which is done under short anesthesia. So it is not painful. Sonography is definitely not painful. It involves embryo transfer, which is again not painful. It is done through the normal orifice only. So nothing is painful. And most of the women are really scared of IVF, and they just would not come saying that, we have to take a lot of rest after IVF. I will not be able to climb stairs. We will not be able to do exercise. We will have to stay here around the center in Indore. And, that is the reason why I'm not taking IVF. So this is a wrong notion or a myth. and rather nothing is painful. Rather, all the investigations as well as the treatments are done under short anesthesia. And I can definitely say, and yeah, maybe they talk of daily injections. So those daily injections, the needle is so small, just to be taken under the skin. It's just like a mosquito bite. So Payal, just believe me and trust me that IVF is not painful at all. Now, there are many other myths which are involved with IVF. If we talk of IVF, then firstly, selection of center. Because choosing a clinic or choosing a center, whenever we talk of choosing a center, probably, there's a lot of glitter and glamour and, chain of centers. People think that better work is there, done there, and maybe, the more expensive the IVF, better will be the result. So this is all not true. This is again a myth. You have to choose a center where the doctors are available. Only one doctor looks after your entire treatment, and you are seeing one person. The entire team is focusing at one point, and you can even inquire about the results of that particular center before choosing the center, because the credentials of the center, the expertise, the infrastructure, the lab, which is very important to select the IVF center. So that has to be judiciously selected. Another myth is the cost. Most of the people are really scared to come to the IVF center thinking that, it is going to be very expensive. So I just tell them that you may be required to go for a joint replacement. You may be required to go for a heart surgery. And these surgery or any plastic surgery cost not less than 3 to 5 times of IVF. And still we get it done. Now, IVF involves making the baby from one single cell of the human body, one cell from women, one cell from men, and that is the greatest scientific miracle which happens. So this is so specific. It needs a lot of expertise. It needs infrastructure. It needs lot many things. Behind the scene there are lot many things working. It needs a good team. So IVF is not at all expensive. And you should take IVF at a place where your case is not treated like a business, rather it is treated on a humanitarian grounds. I proudly say that whenever we have a patient, we just try to fulfill the requirement, and that to give a very cost-effective packages so that to suit their own pockets. So that is something which is very important. So don't be scared of the cost. And a lot of times, people ask us, what about the add-ons? What about the hidden expenditures? So you should always inquire from the place from which you are taking the treatment, that any other added cost will be involved. If yes, then you should know about it. We get a lot of patients. Another myth, making the treatment more expensive, adding on few things like blastocyst culture, ERA test, maybe laser assisted hatching, maybe PRP, and will this improve the result? Definitely, these investigations or treatments are applicable, but only in some couples. That is a particular subset of women. Suppose there has been implantation failure. The women has got a lot of good embryos, and the embryos are there, and she has failed to conceive in spite of everything being good. The embryos have also been tested, and things are good, but she's unable to conceive with maybe 3 attempts or 4 attempts. In such cases, if ERA test is still debatable but may be performed, and this is a personalized embryo transfer window is known, and we transfer the embryo in that particular time, but we actually don't know whether it would work or not, but certainly only for that particular group of couples. What about blastocyst? Is blastocyst for all? I would say no. This is a method of selection. Yes, blastocyst we do in almost 80% of our cases, in which we need to transfer the embryos to day 5, but in particular group of patients where the egg recovery is less, or maybe the less number of embryos are there, maybe 2 embryos are there, so we cannot take them to blastocyst, because in such cases we need to transfer the embryos in the proper environment at the earliest. Maybe day 3 is preferred. Blastocyst is only done for good prognosis patient where lot many embryos are available, and we can just take them to day 5, so that even if we have less number of embryos which are available for transfer after 5 days of pickup, probably that is okay. Suppose you have 10 eggs, then probably on day 3 you would have 5 or 6 embryos and maybe just 2 blastocysts. That's okay. But if you have only 2 embryos and then we take them to blastocysts, then probably you should be okay if we have nothing to transfer. So blastocyst is definitely not for all, but preferred mode of treatment. There are a lot many other things like laser assisted hatching, in which recurrent implantation failure, the laser drill is done to break the cover of embryo, and then the embryo transfer is done. So this is again for a particular subset of women with recurrent failure, or elderly women, or maybe a cryopreserved embryos which have not been successful previously. And PRP we have already discussed as an upcoming treatment, and not many other small queries again, whether baby would be normal. I would say yes, baby would be very, very normal until and unless you have some genetic problem in your egg or your sperms. Will the baby look like me? Yes, definitely. Why not? The baby would look like you. Believe me, in all these years, we have treated so many cases of egg donation, embryo donation. And when I look at those children, I also forget that these eggs are not. Sometimes I tell the baby is looking like mama, and later on I realize that probably the eggs were not hers. So you actually start seeing yourself in your children. So don't be afraid, don't be scared. And other queries that I'm asked is whether always LSCS. So it's not so all IVF for LSCS, but yes, the incidence is higher than normal because the women may be elderly, may be having blood pressure, sugar, twins, and a lot many other factors which are there as a high risk factor, which compel us to do a cesarean because we want a safe mother and a safe baby. And another interesting things that doctor, I just don't want twins, or some people would say, doctor, can you just give us twins? So this is another issue that we need to counsel the patient that yes, of course, twins in India is preferred, but we cannot say whether you would have twins or you would have single, because a lot of times we go for single embryo transfer, which is definitely safer, but sometimes in particular group of women, we have to transfer 2 embryos. Also in those cases, suppose the implantation is good and the embryos are of very good quality, both the embryos get implanted and they may be having twins. So a lot of the rate of twinning is higher than normal, but then not always twins. So I think we have tried to answer a lot of queries and questions which must be existing. Another thing, people ask us whether genetic material, hamare egg or sperm change to nahi ho jayenge. So now I think less number of people ask us this because this was prevailing in the minds of people in the past, but probably not when they choose a good center, then probably they don't have such things in mind. And even if we have to take donor eggs or donor sperms, we have to have a proper consent. Everything is legal. So this doubt should not exist. Rather, you should heartily come forward and take the treatment. There may be a few more questions. Few more questions are there. Yeah, Kiran ji is asking, can you give suggestion about egg freezing age 25? Yes, Kiran, you have not mentioned whether you're married or not, but I believe since you're freezing your eggs, probably you're not married. And I think you would be taking a right decision at a right age, because 25, as I said, is the peak of fertility. And this is a proper age for freezing of egg. So you just need to come to a fertility, you just need to go to a fertility expert and talk about it. So they just give you a few hormonal injections, and then they bring about the egg, and then they cryopreserve them. And in case any other time, if you have got married or something, then probably you could go for a embryo freezing also. So I think this is all. Shubi is asking, I have PCOS. That we have already answered this, I think. Yeah. So any other questions that are there in the mind, you may still ask. I'm ready to answer all. And I would say that if there are none, then probably we have done a good job. And I thank you all. This has been a great session. But I have to leave now. I hope few of your doubts have been cleared. And now we can definitely say at this stage that I am fine, and I have to remain fine. With this note, I take your leave and wish you good luck. Thank you.